The healthcare sector is facing a crisis with a burdened public healthcare system and unfilled positions due to financial constraint. A glimmer of hope was given by the finance minister in his budget speech this week.
Funding will grow from 277 billion in 24-25 to 329 billion in 27-28 to support equitable provision of public health services, including free primary health care services. Like in provincial education, a significant portion of provincial health budget is spent on salaries and wages. 28.9 billion is added to the health budget, mainly to keep about 9,300 healthcare workers in our hospitals and clinics. It's also be used to employ the 800 post-community service doctors and to ensure that our pharmacists do not run out of medicine.
Severe staff shortages and overcrowded hospitals, hundreds of qualified doctors remained unemployed due to budget constraints. Union SABC has been leading the fight for the 1,800 newly graduates, say they're optimistic.
We are particularly happy with the 28.9 billion which will be added to the healthcare budget to address the ongoing crisis of unemployment faced by many healthcare professionals. We believe that this is a step in the right direction, as SABC has been very vocal on the unemployment of healthcare professionals and all the doctors who are sitting at home whilst the country is in substantial need of these skills. We believe that this is very crucial, even in beginning to turn the tide of this healthcare.
Skeptical about the long-term sustainability and effectiveness of these measures.
Understand, of course, the constraints in the budget, given the huge expenditure and limited income, and the fact that government now also has to make up the shortfall that previously was part of the United States soft power and political leverage in terms of funding HIV and other health care programs, and the fact that this will now have to be funded further, putting strain on the health budget.
Post-community service doctors still unemployed. Critics argue that financial mismanagement and a bloated administrative structure continues to divert resources away from frontline medical staff. Hasina Gori, SABC News, Johannesburg.